HR 1319 was just introduced in the House, and I'm going to let HR professionals actually tell you the nitty-gritty details from an HR level. And I'm tagging a creator below that's sounding the alarms, but I wanted to talk about the healthcare implications of this. But a quick summary, essentially this bill would change the definition between an employee and an independent contractor. Why are they doing this? Employer costs, taxes, and likely AI. But here's why it matters for health insurance. If a worker is classified as an independent contractor, then they're not obligated by the employer for employer-sponsored insurance eligibility, and so that would disappear. Most companies only offer health plans to employees and not contractors. Additionally, things like COBRA, which is that gap insurance, that right only kicks in for employees, not for contractors. So there would not be any transition coverage. Contractors typically have to buy their own insurance, oftentimes through a marketplace, and sometimes they can potentially qualify for subsidies depending on their income. But as we're making this a little bit more challenging to obtain Medicaid and other subsidized options, that's not as relevant right now. Oftentimes people who are going to the marketplace face higher premiums, deductibles, and administrative hassles. Also, the plan and coverage overall for in-network versus out-of-network can be a little bit more challenging if you're trying to find an affordable option. In our quest for extreme freedoms, we're essentially turning ourselves into a every person for themselves mentality. Once again, these changes could impact the poor and or rural America, where you have fewer options for care overall. I fully understand that everybody has fatigue, and this bill was merely introduced, but I would advise everybody to send a quick email to your representative to let them know this is not of interest to you. This is a win for corporate America, and I get that I'm a business, but I'm a human, and this is wrong. Good luck.